Probably the most important thing to know about colon cancer is that every single colon cancer arises from a small polyp in the colon called an adenoma. So these adenomas are abnormal, small, benign growths in the colon, and if not removed, have the potential to grow into true cancers. The best screening tool for colon cancer is colonoscopy, although there are other options. Colonoscopy is going to be the most effective, not only at detecting polyps, we think, but also at removing precancerous polyps. These days, colonoscopy is completely sedated. We bring you into the procedure room, have an IV placed, say hello to the nurse anesthetist, and then simply fall asleep until the procedure's over, and the recovery after the procedure is prompt, it's rapid. Everybody should be screened for colon cancer starting at age 50. There are some subsets of patients that seem to be at higher risk. The first population is African Americans, so we start screening African Americans for colon cancer at age 45, and those are the current recommendations. Other populations that seem to be at higher risk are those who have family history of colon cancer or polyps. The other subset of people that seem to be at higher risk are those with inflammatory bowel disease, such as ulcerative colitis or Crohn's disease. The first thing that young people, men and women, should be aware of is that if you notice a change in your bowel function, if you are told you're anemic, if you notice blood in the stool, you should address this with your primary care physician and have a discussion and make sure that screening shouldn't happen earlier. The current recommendations are beginning screening colonoscopy at age 50. The American Cancer Society has come out officially saying they disagree. Screening, because of this new data, suggests that it should be 45, beginning everyone a colonoscopy or some form of screening at age 45. My own feeling is that that's going to be the correct number. Over the last several months with COVID, there's a reluctance to have any interaction with the healthcare system, and especially for healthy patients looking to have a screening exam. The entire Yale New Haven health system with respect to ambulatory procedures now is taking great care to make sure that these procedures are done safely for the patients and the staff. The statistics speak for themselves. Since we began or restarted endoscopic procedures in June, the safety data is excellent. And we will continue to advise patients to not wait.